Hello everyone, I'm Dr. Shweta Yadav, Consultant Obstetrician and Gynecologist at Ovum Birthing Center, Kalyan Nagar. Today I'll be talking about a very common gynecological problem that we come across in our everyday practice, which is fibroid uterus. What is fibroid uterus, or what is a fibroid? A fibroid is a benign, meaning a non-cancerous tumor or a growth that arises in the uterus. So it is depending on where the fibroid is located. It can be of three varieties mainly, which is submucous, intramural, or the subserosal variety. The fibroid that is placed more towards the inside of the uterus is called the submucous variety, and this is what causes major problems. The size of the fibroid can vary anywhere from a seedling, which is less than half a centimeter size, to it can grow up to the size of a full-term pregnant uterus. So the size is quite it varies a lot, the size of the fibroid. Now, what are the symptoms of fibroid? The symptoms can be lower abdominal pain. It can cause heavy periods and painful periods. Sometimes when it is towards the inside of the uterus, it can cause fertility issues. And if the fibroid has grown to a significant size, like more than 10 centimeters or 12 centimeters, it can cause urinary symptoms like frequency of urination, inability to pass urine freely, or if it is very huge, it can cause other pressure symptoms also. Now, how do you treat the fibroid? So the fibroids are treated depending on the size or the number of fibroids, or depending on the problem it is causing. A small fibroid that is not really causing any problem need not be treated. So a fibroid that is grown very large, coming in the way of pregnancy, can be treated. And the fibroids that are causing period problems like heavy bleeding, abnormal uterine bleeding, or very painful periods need to be addressed. So the women that are desirous of fertility, again, the fibroids have to be addressed. So what are the ways in which fibroids can be treated? It can be medical method or surgical method. These are the main treatments available. Medically, we can shrink the fibroids by giving tablets, but that is a temporary effect. Once the tablets or the medications are stopped, the fibroids could regrow in size. So the more permanent treatment available for fibroids is removal of the fibroid surgically. The surgical removal of fibroid can be a myomectomy, where you will only remove the fibroid from the uterus, or in severe cases we also go ahead with hysterectomy, where the entire uterus is removed. So this again can be done in two ways, that is the laparoscopic surgery or the open surgery. So now, apart from these surgical method and the medical, there are other methods like MRG HIFO, where magnetic resonance guided high frequency ultrasound waves are generated and targeted at the fibroid, and then it shrinks in size. That is the third option, and the fourth option is uterine artery embolization. Though the third and fourth are not much practiced, it is mainly the mainstay of treatment is either going to be the medical or the surgical. The more permanent method would be the surgical. So I hope you have got some information, useful information regarding the fibroid uterus today. So if at all you are diagnosed, and how do you diagnose? It is because of the ultrasound that you do. If at all you are diagnosed with the fibroid uterus, there is nothing to worry or panic about it. It can be easily addressed when you approach the gynecologist. Thank you.